Hello and welcome to today's Lunch and Learn Rise Above Heart Failure. I am Michelle Lane, Senior Director for Community Health and Wellness at North Kansas City Hospital Meritas Health. Thank you for joining us. When your heart pushes out not enough blood, doing regular activities becomes difficult. Our expert speaker today, Dr. James Mitchell, will describe how improving your ejection fraction will leave you with reduced heart failure symptoms and feeling much better. An interventional cardiologist with Meritas Health Cardiology for more than 15 years, Dr. Mitchell is a board certified in interventional cardiology. After earning his medical degree from University of Missouri-Columbia, Rock Chalk Jayhawk, he was an internal medicine resident at the University of Wisconsin Hospitals and Clinics. Dr. Mitchell subsequently did his fellowship training in cardiovascular disease and interventional cardiology at the Texas Heart Institute in St. Luke's Episcopal Hospital. He is a fellow of the American College of Cardiology and also my friend. Please welcome me in joining Dr. Mitchell. Can't talk. Welcome.
Thank you. Thanks for having me.
Yes, we're excited to have you. I've really been looking forward to this talk today. I have multiple family members that have been affected by heart failure, and I think that this information can really help them. So the format of today's presentation is going to be a little bit different than what we've done in the past. We want to focus on some wonderful tools provided by the American Heart Association that can help people understand and manage their heart problem. Our hope is that the people listening today take these tools back with our healthcare team and use them to feel better about their heart failure. Today, you will have these tools accessible in the chat function as well as emailed to you post-presentation. You will get a YouTube link where you can also listen to this whole presentation all over again. So let's jump into the content.
All right.
Talk to me like a fifth grader.
Okay.
What is heart failure?
Well, thanks for having me here today. So let's talk about heart failure, Michelle. So heart failure, it happens when the heart can't keep up with the workload and the demands of the body. So your body's not getting enough oxygen. So there can be two different types of heart failure.
Okay.
You can have systolic heart failure or diastolic heart failure. So systolic heart failure is really when you have a floppy heart. Your heart's kind of dilated, it's not able to pump forward, and the blood will back out from the left side of the heart into the lungs, which can cause shortness of breath, pulmonary edema, also fluid in your abdomen and your legs. Then there's also diastolic heart failure. Diastolic heart failure can occur when your heart basically becomes too stiff. So the heart can't relax, and that in turn can cause blood to also back up into the lungs, creating symptoms.
Okay. So heart failure is actually pretty common, right?
Heart failure is very common. In fact, about 1 million people are diagnosed with heart failure every year. There are 7 million people in the United States that have been diagnosed with heart failure. And so it's very common. Probably a third of our patients that we see in the office have some form of congestive heart failure.
Wow. So what are some of the common causes for heart failure?
So there's several different types or causes that can lead to congestive heart failure in patients. First off is just high blood pressure. People don't realize that having uncontrolled hypertension can lead to your heart not functioning well. In fact, your goal blood pressure by national guidelines is to be less than 130/80 millimeters of mercury. And so if you go around with a blood pressure in the 180s, that can cause damage to your heart, it can cause damage to your kidneys, and all of these things can lead to fluid backup. Diabetes is also very important. It's good to have control of your diabetes. Your goal, hemoglobin A1C, should always be at least less than 7%. Because if you're not having good control of your diabetes, that in turn can lead to the buildup of coronary artery disease, which can lead to a heart attack. And so thirdly, then you can also have issues with your valves. So you've got your arteries on the outside of the heart, your coronary arteries, but then you've also got one-way valves inside your heart that form the plumbing. So sometimes people can have issues with their aortic valve where they develop aortic stenosis and they can't pump blood out through the heart to the rest of the body. Or they could have a problem with their mitral valve. Usually that's leakiness in the valve, and that in turn can cause fluid to back up and not get pumped forward and back up into your lungs. Then obesity is a big risk factor for developing heart failure. There's even obesity-related congestive heart failure. And just being obese can cause issues with your diabetes, your hypertension, your cholesterol. And then lastly, as we mentioned, if you have issues with coronary artery disease like previous heart attack or blockages, that can lead to problems where the heart function doesn't pump as normally or as easily.
So knowing the cause of your heart failure is extremely important. There's a section of the tool that we're providing for you to be able to review this with your healthcare team. So what are some of the symptoms then for heart failure?
So symptoms of heart failure can sometimes be difficult to realize, especially as we get older. Sometimes as we start to slow down, or if we're getting fatigue, we think that that's just because maybe we're getting older, we're in our 80s. But in reality, sometimes there's a medical problem that can be fixed and reversed for that. So symptoms of heart failure could be increasing tiredness, it could be fatigue, it could be shortness of breath just walking down to the mailbox. It could be swelling in your legs, and often the swelling is what we would call pitting edema, where you push your thumb into your shin bone and then it stays there. There's a pit in it. You can also have problems where you feel dizzy. Your weight starts to go up despite the fact that you're not eating anything significantly more, or maybe you're even eating less. And then you can always have problems like chest pain or angina, which in turn leads to heart failure. And then finally, sometimes we notice that, gosh, why is my husband not sleeping in bed anymore? He's sleeping in the recliner chair in the family room. And that's because every time he tries to lay flat, he starts to get winded or short of breath. And that's a sign that fluid's building up in your lungs. So now we talk about, okay, how do we make the diagnosis of heart failure? So there's several different tests that we would use to do that. When you go and see your physician, oftentimes he's going to get blood work on you, and sometimes your sodium might be low, or he might check a lab called a BNP, or brain natriuretic peptide. And if that's elevated, that can signal that you're in congestive heart failure. He'll get an EKG to see if maybe he or she, or if you've had a heart attack. A chest x-ray will look for fluid on the lungs. And then probably the most important test when we diagnose heart failure is to get an echocardiogram. An echocardiogram is an ultrasound of your heart, like an ultrasound of a baby. And when we look at this ultrasound, it's going to be a black and white image, and it's showing your heart function. It's also showing all of your valves. And what we look for is any abnormalities in that your heart function is not pumping so well. And we objectively call this your ejection fraction. So ejection fraction is how much blood you pump out with each heartbeat. And normally it's not 100%. Normally it's about 50 to 60%. So then you take how much blood you're pumping out of your heart, and you divide it by the amount of blood in your chamber, and that gives you your ejection fraction. If your ejection fraction is reduced, let's say it's 40 to 50%, that puts you in an at-risk category where you could develop heart failure. Maybe if you were not following the rules, your diabetes was out of control, or you're eating salty foods. But for sure, if you're less than 40%, if you're like 30% or 20%, more than likely you are going to have some symptoms of heart failure until you get that treated and on the appropriate medications.
Interesting. And so in the tool that we're going to provide you, there is a section for you to review your ejection fraction with your healthcare provider.
So also when we're talking about heart failure, we talk about different zones. You're in the green zone, the yellow zone, and the red zone. And even on that last slide about the ejection fraction, it's interesting. That said that when you're above 50%, you're in the green zone, which usually you're not having issues, though you can have some problems even at a normal ejection fraction. And that's the stiff heart issue. And your yellow zone is when you're down in the 40s, and your red zone is down when you're below 40, when you can tend to have significant problems. But then we also talk about the red light, or green light, yellow light, red light in terms of symptoms. So if you have a history of heart failure, your green light zone is really if you're feeling good. You're not having any problems with shortness of breath, you're going down to the mailbox without any issues, you're not having any swelling. And then you're taking your pills and you're good to go. But if you start to notice some mild shortness of breath, then you're getting into that yellow light, okay? You're starting to have a little bit of a dry, hacking cough. Maybe you've got a little bit of swelling, your weight has maybe gone up by a pound or two. That's when you need to get concerned. You need to make sure that you're taking your medications appropriately, make sure that you're getting enough rest, and watch it closely, because you can easily tip over into your red light zone. And so your red light zone is when you've gained 2 or 3 pounds in a day, or maybe 5 pounds over a few days, and that weight isn't going away. Now you're having what we talked about you can't lay flat. That's called paroxysmal nocturnal dyspnea or orthopnea. Your fluid is staying on your legs. It's not going down. Maybe you're having some angina or chest pain. And that's the time when you really need to go and see your cardiologist or your primary care doctor.
Excellent. That's great information.
So then we talk about, okay, so how do we treat our heart failure? Well, we're going to talk about 8 different things here briefly and just some of the lifestyle changes that you can do to improve your heart failure. The first one, which is the easy one, but it's also probably the hardest one, is physical activity. Okay? So physical activity, the best thing you can do for your heart is get out there and do some exercise. Now, obviously, it's really hard sometimes. Sometimes as we get older, we have other issues like arthritis or a bad hip, and it makes it difficult. But we need to try to do some exercise, even if it's just walking for 20 minutes a day. It's better than nothing. And even doing weights is good. You know, obviously we don't want you going out there and doing super heavy weights, but even small amounts of weights in the gym is good for your heart. It's good for your muscle tone.
Mm-hmm. I think it's important also to maybe consider cardiac rehab too at this point. It offers some really unique benefits. You know, you've got this piece that's the physical, mental, and social component that can really help people. You do need a referral for that, but I just love our program here at North Kansas City Hospital. It's nationally accredited, award-winning, so I think that's super important.
Right, so cardiac rehab would be excellent. And you also want to watch your weight. Like we talked about in the red light, green light, yellow light. You need to wake up every morning, usually when you first wake up before you've had any breakfast, be in your pajamas and take your weight and write it down and monitor that every day. Mm-hmm. Because that's going to be your weight that you monitor as your dry weight to see what happens. And that's when, if it starts to go up by a few pounds, you need to start to get concerned. Okay.
Mm-hmm. And is there a parameter around that weight? Like how much is alarming?
We get concerned if you go up by, say, 3 pounds.
Okay.
Okay. Or 5 pounds in 5 days and it stays on. It doesn't go away.
Okay, good to know.
You also need to worry about any other harmful substances. So tobacco abuse is one of your biggest risk factors for coronary artery disease, which in turn would lead to a heart attack or myocardial infarction. It's good if you can find some kind of program to help you stop smoking. Any other harmful substances, alcohol. Alcohol, believe it or not, if you drink too much, it can cause your heart to dilate. Okay, and also then any illicit drugs like meth or cocaine can cause significant damage to your heart and lead to your heart basically getting burned out.
Mm-hmm. We've got a tobacco cessation program here at North Kansas City Hospital. It's called Giving Up Tobacco, and it's actually evidence-based from Mayo Clinic. So they meet on Mondays or Tuesdays, and there'll be information later for people to learn about that program if they want to enroll.
The next thing that we need to watch out if we're going to watch our heart failure is salt intake. Salt intake is really difficult, especially if we eat out a lot. And sometimes it's harder as we get older just to have fresh foods in the house. Mm-hmm. So if you do eat out, it's hard, but you need to try to find out how much salt are in all of these foods, mm-hmm. and try to do some type of substitute. The goal is that you should have less than 750 milligrams of salt a day, which is actually less than a teaspoon of salt. But it's really tough. Even like a microwave lunch or dinner is going to have a lot of salt in it. So fresh foods are your ideal way of getting around that.
Mm-hmm. There is a section in your tool to help you document your daily sodium limits and have some recommendations to help you manage that too. So make sure you're using that tool.
Fluid intake is also important. Ideally, you want to have, so if you think of a 2-liter bottle of soda, you want to have that maybe 3/4 of that of water. You don't want to be drinking things like soda pop or alcohol, even caffeinated tea or coffee really isn't good for you. I mean, you really want to stick to like water. Gatorade for somebody that has congestive heart failure is not good because it's full of salt and electrolytes, and that in turn can tip you over into the congestive heart failure spectrum.
Mm-hmm. My grandmother has heart failure. One of the things that she does is she uses really small drinking glasses, and then she freezes like little grapes, cuts them in half, or has a hard candy or something like that. She also put a humidifier in her home to help kind of moisturize the air so she didn't feel as thirsty. So those are some suggestions. Yep, people can do.
And then also managing your stress. I mean, the problem is that when you have a diagnosis of heart failure, that can be very disconcerting. It can cause you a lot of stress and anxiety. And one of the biggest things in treating this is also to manage your own stress. And how you can do that is, if any exercise is an antidepressant, things like yoga can help out with managing your stress, but also just having a good support group. If it's your family or friends, being isolated at home is never good for any of your medical problems, including your heart failure.
Absolutely. There's a section in your toolkit that is going to talk about some strategies that you can use for stress management. We also offer a program, I don't know if you're familiar with it, called Circle of Friends here at North Kansas City Hospital. So it's for people that don't have contact with a lot of people from the outside. So there's more information at Your Health magazine that you can learn about that.
Fantastic. And then also we talk about sleep or your rest. Something that people also often don't think about is sleep apnea. So if your spouse says that, gosh, you stop breathing in the middle of the night, you snore a lot, it causes them difficulties, that could be undiagnosed sleep apnea. Sleep apnea is something that can contribute to the strain on your heart. And so if those are the conditions that you're having, you need to let your doctor know and be referred to a sleep specialist for a sleep study to see if you need a device called a CPAP that you wear at night. And most people that end up getting fit for a CPAP will tell you that they feel 100% better. It takes some of the strain off the heart, but it gives you increased energy, you sleep better through the night, gets rid of any daytime headaches. So it's a really important diagnosis to make if you're being bothered by that.
This is excellent information. Thank you for this. So let's talk a little bit about the treatments for heart failure.
Sure. Well, we can go through some of just the basics. So in terms of the treatment of heart failure, you've got your medications. Your medications include the basics of a beta blocker, such as metoprolol or carvedilol, which helps take some of the workload and the strain off the heart. You also have ACE inhibitors that decrease the workload that your heart pumps against in the body. You could also be on an angiotensin receptor blocker or something like Entresto, which helps work the same way. And then you have your diuretics, which are your water pills. And those are very important. You may have heard of Lasix or furosemide or spironolactone. And that's what you end up using when your weight goes up. Sometimes we have you double the dose of your furosemide to help keep the water off. And those are your basic medications of congestive heart failure. Now, when you're seeing a cardiologist, they're also going to try to find out, well, why are you having heart failure? What other devices are there that we could help you out with? And so if you have a dilated, a floppy heart, sometimes we end up recommending that you have a defibrillator placed or a special type of pacemaker called a biventricular pacemaker that can help your heart beat in a more coordinated fashion so it's not so floppy. We would probably also do a stress test on you to see if you have underlying coronary artery disease, which could end up leading to a cardiac catheterization, which could lead to a stent or even open heart bypass surgery. And then we mentioned that sometimes you have an issue with the valves in your heart. And some people will have what's called severe aortic stenosis. And at North Kansas City Hospital, I do a procedure called transcatheter aortic valve replacement. So if your one-way valve on your heart is tight and you're not able to get the blood flow through, it's kind of like you've got your thumb over the end of the hose. So your oxygen isn't going through and you're going to become fatigued. Well, traditionally, the only way that you could fix that was to have open heart surgery and replace the valve. So now we have a procedure where we actually go up through your groin with a needle stick. Under X-ray, we implant a new valve inside the old valve. It only takes about 30 minutes to do. And you go home the next day from the hospital. So it's really a groundbreaking procedure that we've been doing here for about 8 years. And so there are a lot of different things that you can do to try to help somebody out. Okay.
Wonderful. Those are great.
So there are questions when you meet your primary care physician or your cardiologist. You want to ask them several questions. And this slide is for everyone in the audience. You want to ask them, does my low ejection fraction have a cause? What is my ejection fraction? How can we improve that? What medications can we use? Are there any procedures or stress testing that can be done? What type of exercise is safe for me to do? And also what types of stress management, or ask about cardiac rehabilitation. Ask if you would qualify for cardiac rehab, because that would be very important.
Those are wonderful suggestions. You know, recovery becomes so much more manageable when you have the right type of emotional support. So we do have a cardiac support group here at North Kansas City Hospital called Mended Hearts. We meet once a month around noon, and you can do that virtually or in person. So that's something I recommend for everybody to be involved in. Those were wonderful questions for people to talk to their healthcare provider with. But speaking of questions, let's go ahead and move to the audience and see if we have any questions that need to be answered through there. All right, we've got one. It says, I have a cough that will not go away, and my doctor says it's from heart failure. Why does heart failure make you cough?
So heart failure makes you cough because your heart's not able to pump that blood forward. So fluid begins to build up in the lungs. That in turn can cause you to cough, okay? And there are some other reasons too. And also one thing that you need to look into is if you're on an ACE inhibitor called lisinopril, sometimes the side effect of lisinopril or an ACE inhibitor is that it will give you a chronic cough. Not everyone will get that, but it's like that is more of a dry hacking cough that just never goes away. And in those patients that have an ACE inhibitor cough, we end up switching them to what's called an angiotensin receptor blocker, and usually the cough goes away right away. So that's one thing you always want to bring your medication list when you see your doctor so they can review everything, make sure it's up to date, and see if it is fluid causing your cough or is it a medication causing your cough.
I always see that there's lots of discrepancies sometimes. You know, they can have their home medicine list of what they're actually taking compared to what the office has, and there's sometimes
and that can
don't line up.
cause big confusion. It can cause problems for the patient. One thing that everyone in the audience should think about doing is getting a pill box that lays out every single day of the week, just to organize that. Having to get it out of every bottle every day often leads to problems.
All right, let's see if we have another question. It says, how do I sign up for the cardiac support group? So at www.northkansascity.org/support groups, there is a place you can enroll, and we will also put a link on that with the email that follows this presentation today.
The next question would be, how often should someone have their ejection fraction checked? Okay, well, when you first get diagnosed with heart failure, you definitely are going to have an echocardiogram. And then it really it depends on what the first echocardiogram shows. So if you have that dilated heart, okay, then we're going to put you on medications. Maybe you end up getting a stent to try to improve your ejection fraction. Usually, I will then repeat an echocardiogram at 3 months. That gives enough time for the medications to have effect, and then we see if your ejection fraction has come up, okay? Now, it's a little different if you have, say, a valve problem, like aortic stenosis. Then we do it sometimes more frequently or less frequently, depending on how bad the valve is. But usually after your initial diagnosis of heart failure, I get it at about 3 months. And then after that, kind of depends if your heart function's gotten better or not every year or two after.
Okay. Someone says, my blood pressure runs 150/80s. Do I really need to be concerned?
I would be concerned. Again, your goal blood pressure should be less than 130/80, and those are the national recommendations. So if you're consistently at 140, that's a risk factor for heart attack, it's a risk factor for stroke, it's a risk factor for congestive heart failure. So you need to be placed on some type of medication by your primary care doctor or your cardiologist.
All right. There's another question. It says, my doctor says I have congestive heart failure. Is that the same thing as plain heart failure?
It is. So sometimes we use different confusing terms, but heart failure, plain heart failure, and CHF, or congestive heart failure, it is the same thing. We're just using a little bit sometimes confusing terms.
Yeah, you know, I noticed with my grandmother, she says, oh, I have fluid around my heart. And she's never said the term heart failure. When I talked to her about that, she's like, no, I just have fluid around my heart.
Yes.
So, and then another question, it says, are there any vitamins or minerals I should be taking for my heart?
Well, that's a good question. So I think taking a multivitamin a day is good. Okay. But sometimes people get into issues when they're taking all these other supplements. And the problem is if you're on a lot of other prescription medications, and in particular if you have an irregular heart rhythm called atrial fibrillation and you're on Coumadin or warfarin, some of these over-the-counter supplements, they're not regulated by the FDA, so we don't really know how pure they are. And some of those can interfere with your levels of your other medications. Warfarin or Coumadin, it can cause your levels to go up or down, which could cause a bleed in your brain or a stroke, and it could affect, say, if you're like have seizures and are on seizure medications. So I tell people a multivitamin a day is fine. I would not get into all of the ginkgo and all of the other things. I think it leads you into trouble.
Okay, that's great advice. All right. Can diastolic dysfunction ejection fraction be improved?
So diastolic congestive heart failure is where you have the stiff heart. And so you can't really, it's a difficult diagnosis. You end up getting put on diuretics or the water pills to help you out. But in terms of purely relaxing the heart, it is difficult. Sometimes people have diastolic heart failure because they have uncontrolled high blood pressure. So getting your blood pressure down under that 130/80 can help your stiff heart pump more easily. But there isn't any pure way of reversing the diastolic component.
That's great. All right. It doesn't look like we have any other questions. That was wonderful information.
Good.
Thank you so much for sharing that with us today. And we hope this presentation was informative and helpful. Please join us Monday, May 20th for our next Lunch and Learn, which is the Beginner's Guide to Anti-Aging Treatments with Kelly Baker, a nurse practitioner from Bella Derma Medical Aesthetics. Again, thank you for joining us and have a good afternoon.